Hello friends, how are you? This is Dr. Sri Nagi, Ayurveda medicine doctor and also Isha Hatha Yoga teacher. So today in this video I am going to talk about the pre-diagnostic signs and symptoms for kidney disease. Regarding kidney disease, many times this happen, like people suddenly get into shock, like our kidneys stopped working, or we went to hospital and just doctor said, okay, your kidney is landing into failure, or do something about it, or you should go for dialysis, or sometimes they ask for certain precautions. But in Ayurveda there is a concept called Purva Roop, or early diagnostic symptoms of kidney disease. Purva means pre and Roop means the signs and symptoms. If you are well aware of pre-diagnostic sign and symptoms of kidney or the alarming signs for kidney which need early diagnosis so that you can protect your kidneys from major diseases. So in this video I will tell you certain very common signs and symptoms which you can feel by yourself and you can make the kidney health better, or at least go to hospital at the very early stage of kidney disease, so that no need kidney transplant, no need some kind of dialysis, and your kidneys will be recovered naturally and properly. In kidney, or if you say urinary system, there can be many things where disease can happen, like there are ureters, there are kidneys, there are nephrons, there is urethra, and like various organs are attached when we talk about excretory system or renal examination. Many other things comes. More details are needed for medical students, not for general people. For general people, there are certain signs and symptoms. If you pay attention, you can save your kidneys well in time. So let's see what Ayurveda has to speak about it. And I feel like everybody should be aware of these sign and symptoms so that they will not invite any kind of problem in their life, and they take timely precautions so that no problem happen in their health and well-being. So first and foremost thing regarding it is, if you feel any kind of puffiness in this area, under eye puffiness, you must have seen in many people they have puffy eyes. So when I say puffy eyes, puffiness means some kind of swelling. This area, under eye area, it is swollen. If you are feeling this puffiness under your eyes, and if you also have some other symptoms associated with it, like polyuria, means if you are going to for urination again and again very often, in half hour 2 times or once in half hour, and at the same time you are feeling there is puffiness under your eyes, that means it is time that you visit your doctor and do your renal functioning test. That is the test that is required to check the functioning of kidney. And if RFT, that is renal functioning test, is coming to be normal, then this puffiness may be because of certain other reason. But if it becomes little bit altered, then your doctor or nephrologist will guide you what need to be done. So this is the early thing which happens, and many people don't notice it because it is not a very prominent sign. It is very mild here, puffiness happens. So all those people who feel like they have this sign of little bit puffiness, they can go and visit their laboratories and go for RFTs, that is renal functioning tests. It's very simple test, and it's a group of tests, and this is to check whether your kidneys are healthy or not. Next thing which you need to notice, for many people this happens, this is called hematuria, or the blood in urine, or urine is mixed with blood. So if this symptom happen to you, don't ignore it. At the same time, don't get scared of it. Like, no need to get scared, oh my god, blood in urine, what happens? It is just one of the sign and symptom that you should also not ignore. If this is happening, that means also you need to visit your nephrologist. And this blood in urine happens because of many reasons. Sometimes stones, sometimes your renal stones are there, they started moving, that time blood comes. Sometimes some renal cyst is, infection is, sometimes because of that it happens. But for all reason it can be totally curable. So no need to worry about it. You just visit your nephrologist or visit your doctor. He will tell you what to do. But at the same time, my purpose of telling you this symptom is, don't just sit in the home and get scared and not go to the doctor. It is the time that you visit doctor, because if this symptom is happening, it's quite normal, and you go, he will diagnose properly either with ultrasound or certain tests, and or either with palpation, and he will let you know what is the problem. So no need to worry, but at the same time don't ignore this symptom. Next symptom or next observation which you need to observe, or patients mostly observe, if there is some kind of swelling in the feet. So if there is some kind of swelling in the feet and you are just thinking it is because of, we don't know why, there is no pain but there is swelling, and when you put thumb in it, there is a dip happens, like something just like a dip happens on the skin. So if this thing is happening, there can be many reasons there can be many reasons for this, but one of the reasons is it can be related with your kidneys or renal problem. So in these cases also, don't go for self medication. Okay, I have this swelling, that means I have kidney disease. Self medication, I never advise self medication, because self medication can be more harmful. Please note this line, more harmful than anything else. So it is always better, like, you take the advice of those people who know best in this field, because the people who have given 10-12 years to this field only, they are specialized in it, and believe me, they know better than you. So it is very important, if you are feeling this kind of sign and symptom, you visit your doctor, but at the same time visit some trustworthy doctor. Not like in every field there is adulteration, whether it's medical field, spiritual field, or any field in the world, there is adulteration. So make sure, like, you first inquire properly to which doctor you are going, and accordingly you take treatment. Believe me, there are good people in the world, and they want to do good for their patients, and they want to serve patients, but it is just you need to choose consciously. At the same time, I again want to tell you, don't just ignore this swelling. It is not something dangerous. In cardiac patients also sometimes this kind of swelling comes, but mostly on the, like, this is your feet, on the top surface of feet, if you feel this kind of swelling, it is better you visit your nephrologist or even internal medicine doctor. If you go, if there is no nephrologist, you go to internal medicine doctor. He will guide you what to do about it.